Part 4, Non-allergic rhinitis. This lesson is 19 minutes. Dr. Krako will discuss non-allergic rhinitis, a condition of nasal congestion, runny nose, or stuffiness triggered by various factors unrelated to allergies.
Now this next one, this is really exciting stuff. Non-allergic rhinitis. There are so many things out there that patients and doctors are not paying attention to with respect to how they can help their patients when they have this particular condition. Now, non-allergic rhinitis is also called vasomotor rhinitis, or it used to be called that. And it's also possible that amongst certain groups of allergists or ear, nose, and throat doctors, they may see these slightly differently. They may have different definitions for these that are overlapping without necessarily being the same thing, because there are a number of factors and issues about non-allergic rhinitis that are so worthwhile to try to investigate, in your patients. So non-allergic rhinitis basically means you get some symptoms that are like this, allergic rhinitis meaning the congestion, but you tend to also get things like runny nose, or you've heard terms like postnasal drip. You certainly get the stuffiness, the clogging feelings, all these kinds of things. So it's not the same as allergic rhinitis, where there tends to be the sneezing, itching, and so forth. The question is, why do you get that? Why would people, if they're not getting an allergy, like a pollen in their nose, why would you be at risk for this condition? And by the way, this is very, very common in sleep practice. In our sleep practice, we see as many as 80% or higher have allergic rhinitis. But we see as many as 25 or 30% that have non-allergic rhinitis. And non-allergic rhinitis, by the way, is much more difficult to treat. It's much more confusing to treat. So we're going to take more time on that. And you really have to be, as what they call the personal scientist, to want to figure it out if you have this condition. Sometimes it's even difficult to clarify this with your own physicians, because they may not have some of the expertise or awareness about it, or they may write it off in some way, imagining that maybe it's not that important of a condition for you. Well, it's very important for us in sleep medicine. Why? For the same reasons as before. If you want to sleep better, you do not want your nose to be clogged. Where does one start with non-allergic rhinitis? The first place is, what could be causing it? And the answer to that is that it's generally related to the environment. And when we say the environment, now we mean things like dust can cause it, irritants that are in your home or at your workplace. But other aspects of an environment which are pretty amazing are wind, temperature effects, even weather effects. There are people who will say, there are these times when I notice I have this problem. Now, some of them will just say, I have it all the time. I have postnasal drip all the time, or I have a runny nose all the time, or congestion all the time. But on careful inspection, they'll discover some of these things. It's very common for somebody who has this, non-allergic rhinitis, to often have a little of this. So somebody's going to come along and say, all right, well then let's just go ahead and treat the allergic rhinitis and see if it helps the non-allergic rhinitis. In fact, that's the single most common approach that you'll generally hear in certain, or maybe the majority of doctors' practices. Well, it looks like you've got allergic rhinitis, maybe you've got a little non-allergic rhinitis. Let's just start you on Flonase and see what happens. And of course, the good news is that some people will respond, and they will actually get improvement in both conditions just from using a nasal steroid. But I wish it were that easy, because it turns out in our sleep practice, we see patients all the time where it's not that easy at all. It's much more complicated. There's many, many other factors that are going on that have to be addressed. One of them, which is quite remarkable, is this one. This seems to be hugely connected to non-allergic rhinitis. When I diagnose a patient with non-allergic rhinitis, before I'm looking through the chart or asking any questions about anxiety, it's true that I'm picking up certain vibes from the patient as I'm talking to them, but I ask them to describe their symptoms of this first. They're giving me the symptoms that sound like they notice with dust, wind, temperature changes, weather changes. Okay, sounds like non-allergic rhinitis. Then we have a further discussion. About 95% of these individuals report that they have anxiety. Now, here's what's so interesting about this in terms of what's called a bidirectional relationship. What do you think happens to anybody when their breathing isn't right? What emotion, what feeling are they going to feel? They're going to feel anxiety. Everybody knows what it would feel like to have a little claustrophobia, or to suddenly choke, or have a mini suffocation. Obviously, that causes anxiety. Well, for over several hundred years now, even in medical literature and in Western civilization, there are reports of how when you don't breathe well, you get anxious. It could be something as simple as having a deviated septum, could create anxiety. But I'm also talking about the other direction. The thinking is, could you do something with anxiety that somehow triggers either the release of biomolecules in the nose or does something to the nasal blood vessels in a way that causes them to dilate? And the next thing you know, you have a vasomotor, that's where the name originally came from as I understand it. You have a vasomotor reaction. And now you have clogging in your nasal passages and you end up with a symptom. The symptom could be congestion, stuffiness. All right, so that's one that's very, very important. So for those of you who suffer from anxiety and you have some concerns about non-allergic rhinitis, one of the things you're going to want to begin to think about in your life is, if I reduce some of my anxiety symptoms, would it help me to breathe better? Or, if I can improve my breathing symptoms, would it help me reduce some of my anxiety? So that's very important. Here's another one. This one is very commonly unknown. When a person has reflux, and we say that word, we often think about heartburn. We go, all right, well, you mean heartburn, right? Well, yes, I mean that as a subset. But you can also have acid reflux in various areas of the stomach up through the esophagus that, for whatever reasons, are minor enough that you're not aware of them. And you don't actually feel them that much. Or you don't have like sort of symptomatic responses to certain kinds of food, let's say. Or, lying flat on your back. So reflux is not just that classic reflux. That reflux can be going on in the bottom of your throat in what's called the laryngopharyngeal area, the bottom of the throat. And if that reflux is going on and that acid is stimulating those tissues, do you know what the response to the tissues are? They produce mucus. And that mucus now has the capacity to trigger other problems in the throat. And now suddenly we have something that sounds very familiar. Postnasal drip, congestion, stuffiness. Again, it sounds like non-allergic rhinitis. And this one, of course, is quite remarkable because, first of all, you might not even be aware of the reflux condition. You might have to go to an ear, nose, and throat doctor who has to put a scope down your throat and look and say, hey, you've got a lot of irritation down here and redness. I think this is a likely sign of a laryngopharyngeal reflux problem. Now you treat this person as if they have reflux, even though they're not describing the reflux as the major symptom. You actually give them the various medications for reflux, and they actually will report that this disappears, that non-allergic rhinitis will disappear. It's very important that these things all be considered in what might be called the differential diagnosis of causes of non-allergic rhinitis. It's not just one thing usually. Most of the patients who have it are very complex. And now we get to the one that makes it just very difficult for you as a patient and very difficult for healthcare providers who are trying to assist people. And that is the fact that there's another way to get this problem, and that is by taking all that list of treatments that I talked about, the saline, sinus rinses, nasal crom, nasal steroids, and doing too much of it. Because think about it. What are you doing when you do too much stimuli? Well, you're doing some of the same things that are occurring here. And to that list of stimuli, I'll add a really big one here for our field of sleep medicine. But just by giving too much saline, just by giving too much nasal steroid, and by too much, I got to be clear, I'm not saying too much, the dose is too high. I'm saying you're doing all the normal doses you're supposed to do, which should help somebody who's got allergic rhinitis, but instead, that person's predominant problem turned out to be non-allergic rhinitis, and what happened? They ended up getting a condition that we call rhinitis medicamentosa, meaning that you tried to treat something and you actually produced more of a response like this. So that's an amazing thing as we work with patients in the sleep center, because when I see a classic case of non-allergic rhinitis, and I know the patient has not been paying attention to their nasal hygiene for years, and all they heard about was taking a couple of pills and was supposed to solve the problem, and it really didn't, I can't just sit there and say, well, I want you to try to reduce some of these influences, and I want you to try a little bit of saline and a little bit of that, because no matter what I offer, that can turn into too much stimuli and actually make the condition worse. So I've got to spend a fair amount of time with the individual and say, let's go through this. Here's all the treatments you can use, but by all means, don't use all the treatments right away. Work at it, figure out which treatments work and which ones don't. Now, many people with non-allergic rhinitis already sort of know the answer to these questions. Why? Because they've been frustrated in their treatment of their nasal congestion for years. And these will be the people who have come in to me and said the words, well, I tried the steroids. And I go, well, what did that do? I say, well, it didn't work. Well, how long did you use it for? And when they tell me, oh, well, I used it for several months and it didn't work, that's a sign that it may have actually made things worse because they had non-allergic rhinitis. So the discussion requires not only clarity about all these precise steps they can take, but also I will have to meet with you or talk with you or email with you, whatever, to say, well, what happened when you did this for 2 weeks? And what happened when you did this for the next 2 weeks? To be able to pin this down and actually come up with something that's going to treat this. Now, on top of all that, in our field, one of the things that's so interesting is what is positive airway pressure therapy. We all know it as CPAP. We usually prescribe BPAP, which is bi-level therapy. It's a little bit more advanced than CPAP. Well, another name for PAP therapy is over here, wind. You're blowing air up somebody's nose. And if they have a very bad case of non-allergic rhinitis, you better believe that now we have just worsened it by putting them on CPAP. And we've actually seen cases like this. And part of it was because either we didn't ask the right questions, the patient didn't bring something to our attention, but whatever it was, the patient has gone back to their home, started using PAP therapy. A couple of weeks later, they say, I've got sinus problems, I've got congestion, I've never had anything this bad before. But the truth is, they've had some of it before, but not as bad because of all the extra wind being pumped up into the nose. This obviously needs treatment. And the question is, what are the treatments that we can do? Well, the first, of course, is trying to eliminate some of those stimuli, which, of course, is not easy for a lot of people. Can you still use saline? Can you still use sinus rinse? Can you use nasal crom? Can you use steroids, nasal steroids? The answer is yes, in general, because often these patients still have some of the allergic rhinitis as well. If somebody has only non-allergic rhinitis, only, you can still try these. And they're very reasonable things to try. And again, you would say to the individual, can you just do the saline for 2 weeks and let us know what happened? If it made things better, you might want to consider adding 1 sinus rinse a day. See if that continues to make it better. So you're going through this progression. It takes a fair amount of time. But now, fortunately, there are these FDA-approved medications for non-allergic rhinitis, and they are known as antihistamine sprays. And the one that's been around the longest is Astelin. I think there's a newer one that's just been coming out called Asterapro. And these drugs are marvelous because this might be the only treatment the person needs. In fact, some people who have both conditions, the rhinitis allergic and the rhinitis non-allergic, they will discover that using just the Astelin solve the problem. Now, with respect to sleep, the biggest issue we want you to hear is that if you are going to be going forward with CPAP therapy or BPAP therapy, it's very important that you clarify this is not the predominant problem you're suffering from when you have nasal congestion. Because if it were the predominant problem, we would rather see you look for all of those factors, whether it's anxiety, reflux, extra environmental stimuli, before we would give you positive airway pressure therapy. We don't want you to put that mask on if you've got non-allergic rhinitis, because there is unfortunately too high of a risk that you're going to end up with a worst case of non-allergic rhinitis, maybe even some sinus problems. You're going to have a miserable experience, and you're not going to want to use PEP therapy. And that's an awful way to start somebody who's got a bad sleep apnea case, who really wants to, motivated, and now all of a sudden everything has been sabotaged. So Astelin is the primary treatment that we use now. These other things can be secondary and useful. Whether or not other things are important, obviously reflux treatment would be very important for certain people. Would anxiety treatment be useful? I don't know. I don't know if that's actually been studied, whether or not you can treat anxiety and see improvement in the condition or not. So to sum up on non-allergic rhinitis, it's very complex in that you're actually asking somebody to do treatments that could make things worse. And now you're saying to the patient, that's helping us clarify unequivocally, this must be non-allergic rhinitis. And then from there, you try to move forward with, okay, let's try to find the simplest or the least amount of treatments that will improve your nasal breathing and allow you to use PAP therapy, in our case, at a sleep center. And Astelin, of course, again, the antihistamine spray is the most commonly used treatment that we will prescribe for these patients.